This is Mayo Clinic Talks, a curated weekly podcast for physicians and healthcare providers. I'm your host, Daryl Chetka, general internist at Mayo Clinic in Rochester, Minnesota. Regenerative medicine has some amazing capabilities, and it has the potential to significantly change how we practice medicine. But it does face some challenges in educating both the medical community as well as general public regarding its realistic capabilities. There are many unsubstantiated claims currently made by practitioners to the public regarding the benefits of regenerative medicine therapy. We'll discuss how the true current potential of regenerative medicine is conveyed to both clinicians and the public with Dr. Dennis Wigle, a thoracic surgeon and chair of the Division of General Thoracic Surgery at the Mayo Clinic. Dennis, thanks for joining us today.
Thanks, Daryl. It's great to be here with you.
Well, you've got kind of a challenge in that there are a lot of practitioners out there claiming all kinds of things that regenerative medicine can do. How do you deal with that in terms of educating not only our patients, but physicians and medical staff on what is actually able to be done with regenerative medicine?
That's certainly one of the challenges in the space. I mean, not only do you have a very exciting scientific and clinical field with all kinds of really interesting activity happening to a volume and a degree that's really difficult to keep track, and that's even for the stuff that's real. So layered on top of that, when you have some claims that are maybe not well substantiated or some things being done that are not really scientifically valid, it can make it very confusing both for patients and even for providers, even those with interest in regenerative medicine applications, to stay on top of what's really real, or even if not real, what is at least something that's got enough scientific validity that it makes sense to be asking questions around it, let's say in a clinical trial based format, versus what is more sketchy in terms of something that's maybe not
Mhm.
real. And
Sure.
there's definitely challenges there for both patients and providers in trying to provide that information, but that was really one of the needs that were identified as part of the genesis for trying to run a service or a consult clinic like this, when it was still in its embryonic form on the back of a napkin somewhere.
Yeah. So what you're referring to is a regenerative medicine consult service.
Yeah.
So that's an interesting way of educating not only the staff, but also our patients. Tell us about it. How was this developed and when was it developed?
The original idea for this, actually at Mayo Clinic anyways, goes back a number of years, and really Tim Nelson from internal medicine here in Rochester deserves the most of the credit for really getting this off the ground and making it happen initially. And he very quickly realized the need, through his work, both in working with induced pluripotent stem cells and trying to work towards clinical applications with those as a cellular product, and then particularly in the space of children with hypoplastic left heart syndrome, just that information void and being able to make the connection, for people with the right information and potentially studies or even real clinical applications that were available was a big void. And so he was the one really who started doing this work through the transplant center, initially just himself on a volunteer basis, and then with the help of a coordinator, which was really the initial gestation of a regenerative medicine consult service, which has now grown into something that's more Mayo official, with more people involved, and something that has become much bigger and more involved than what it was in its original form.
So who submits the consults?
Yeah, that's a great question. So we've still tried to stay true to the idea of what Dr. Nilsson had set up initially, where really this is a service that could be accessed either by patients directly. So the idea is that literally somebody could be calling a 1-800 number or clicking a button on a web page and be able to make that connection, but also importantly for providers, both internally within the Mayo Clinic system, but also outside for anybody that's got questions about anything related to regenerative medicine applications.
That's interesting. So not only the clinical staff, but patients can submit requests and questions too.
Yeah.